For all of us, health is at the foundation of what allows us to participate fully in our lives. Being in good health makes everything else possible. It lets us work, it lets us be active with our families, and it lets us to contribute to society up to our full potential. Health and prosperity are inextricably linked. We have an excellent healthcare system, but our system is focused on treating illness, not as much on preventing it. Our system is also highly stressed, and as one healthcare provider put it, they're so busy pulling drowning people out of the river that they have no time to look upstream to see who is pushing them in. So to prevent illness and promote health, it's necessary to look to the causes rather than the effects. Focusing on cause over consequence means addressing the social determinants of health. The social determinants are health-promoting factors in our living and working environments that influence our vulnerability to disease or injury. The Public Health Agency of Canada recognizes 12 of these factors, and they include income and social status, social support networks, education, employment and working conditions, and physical environments, among others. A large body of academic research, nearly 40 studies in total, nicely summarized in a paper published last year in the journal PLOS ONE, suggests that shifting to an upstream philosophy and focusing more on the social determinants of health will give us a healthier population, reduced healthcare costs, and a more resilient, productive, inclusive, and economically sound society. For those vulnerable or facing challenges, however, social services offered by governments and a variety of other organizations provide the support needed to help people put their lives back on track. We're fortunate to have a robust social support system in Ontario. The supports offered to those in need provide basics that link back directly to the social determinants of health, from income support to subsidized housing, to seniors' companionship programs, to sports equipment for children. These programs help to create a health-promoting environment for all. However, for those trying to access the system, there are a lot of barriers. In particular, there's a significant knowledge barrier that arises from the complex and cumbersome labyrinth of services that's challenging to navigate even for educated and resourceful individuals. Then, to compound this complexity, the services offered by various levels of government, community and religious groups, charities, and other NGOs often have differing eligibility criteria and lengthy application processes, making it both time-consuming and confusing to figure out whether and how to apply. Those accessing the healthcare system or some community programs may be able to draw on the support of social workers, but for the majority, families are left to fend for themselves. Few practitioners even are able to function with an upstream lens, and frequent program changes at various levels makes it almost impossible for a physician, a nurse, a social worker, or a teacher to be knowledgeable about all these services at any given time. So we thought about whether this works for Ontario and asked what seems like a simple question. How can we effectively respond to the social needs of Ontarians and Canadians as a whole if we do not have a holistic understanding of the available resources and a means to better support our citizens in accessing them? We live in the information age, and so I propose that we take the connected and make it interconnected. Could we leverage existing technology to create an organized and integrated social support services and interface portal, linking and enabling access to programs, or LEAP for short? This would be a consolidated platform that would be much more than a simple service directory. Instead, it would offer citizens contextually relevant information, consolidated applications to programs, and the option of seamless referrals to the already existing programs that respond to the social determinants of health. Let me explain how this would work by telling you about Rohan and Meena. Rohan has a small disability pension, making his wife Meena the primary income earner for their family of 3 children under 10. Meena works as a medical receptionist, but the clinic she has worked in for the past 15 years has just closed this summer when the physician who ran it retired. Meena and Rohan are worried that they won't be able to afford to stay in the house they're renting or to pay for the sports activities that their children really thrive in. So let's imagine an interconnected future. Mina would go to her computer or her local library, a Service Ontario Centre, or City Hall. Online, she accesses the LEAP portal. She creates her profile, and through the portal, while completing the online paperwork to apply for EI, she's presented information about a program that would subsidize the hockey equipment her oldest son needs to start the season. The system asks if she wants to apply. She says yes, and it takes the information she's already provided, packages her application, and with a few clicks, she submits it. She then looks for retraining opportunities, and again, with a few clicks of the mouse, she has information at her fingertips, a list of bursaries and scholarships, also with application materials. Navigating to children's supports, she sees a list of programs for the age bracket of her youngest daughter who is having trouble with reading in school. Another few clicks, and she's able to register for the Every Child Ready to Read program at her public library. I think you get the idea. Can you imagine, though, what LEAP would mean to Rohan and Mina's family and their stress level as they navigate a challenging time in their lives? But could you also think what this would mean for Canada? Could we reduce program administrative costs through a centralized intake platform and streamlined application processes? And could these savings be reinvested in program delivery? Could we leverage the de-identified data to provide timely intelligence for policymakers about community social needs to support targeted and timely service delivery, enhancement, and development? Could we promote even greater technological integration, including linkage to e-health records? It's no secret that security, prosperity, and satisfaction in society are directly related to equality. That's what Richard Wilkinson and Kate Pickett argued so well in their book, The Spirit Level. Through interconnection and a focus on upstream social determinants, I think we can make significant strides towards health, equality, and inclusivity. Could we leap, then, to a more prosperous future for us all? Thank you for listening.